The best indicator of replacement fertility is NRR, net reproduction rate. Which of the following is not an injectable contraceptive? Progesterone. What is the approx total population of India as per provisional data 2011 census? 121 crore. Which system of the body gets infected in rabies? Central nervous system, CNS. Separation of infected person from other patient is known as isolation. Which of the following is not the adverse health effect of noise pollution? Excess sleep. Which of these theorists viewed health as synthesis of germ theory? Biomedical. Biomedial. BCG vaccine is given intradermal. The characteristic of an endemic disease is when a disease is constantly present in geographical area. A woman using diaphragm for contraception should be instructed to leave it in place for at least how long after intercourse? 6 hours. The National Rural Health Mission (NRHM) was launched with the aim of further improving health in rural areas. The main functionary or health care provider in this program is ASA. Posting of midwives in the areas under PHCs is influenced by the maternal mortality rate prevalent in the area. In following which is a vector-borne disease? Dengue. Personal barriers in effective communication do not include rumors. Principles of primary health care is all except achieve universal primary education. Carpal tunnel syndrome is a disorder of pregnancy affecting nervous system. The nursing care of patients with dengue fever include all the all of the following except to provide cold compression, injecting or an antigen, antiserum or antitoxin into an individual to produce immunity to a specific disease is called inoculation, which is the responsibility of state nursing council. Implementation of INC standards of nursing education. Platelet count decreases in dengue. According IMNCI, which color code suggests referral? Pink. When an individual comes in contact with an infected person and is isolated for the duration of incubation period, it is referred as quarantine. Which of the following drugs is recommended for prevention of mother to child transmission of HIV infection. Diagnosing which of the following is not a type of communication message. The example that most closely defines a disability is inability to walk. DOTS stands for directly observed treatment short course. Drug used for hookworm infection. Albendazole and mebendazole. Radical anti-malarial treatment is recommended for those who have positive blood film for malaria parasite. Providing health education about the environmental hygiene to the community people is an example of structural communication. For controlling outbreak of cholera, which of the following measures are suggested except mass chemoprophylaxis? All of the following are killed vaccine except BCG. BCG is live vaccine. Health promotion includes the alleviation of causative factors. Post-pill amenorrhea is treated by clomiphene. The process of restriction of movement of persons who have come in contact of diseased person is called as quarantine. International Council of Nurses (ICN) was formed in the year 1899. The first step in the process of community health planning, analyzing health needs. Which is more infectious or risky period into a HIV positive patient? Window period. Polio vaccine is prepared from live attenuated organism. The Indian Nursing Council Act was proposed in 1947. Which of the following disease gives lifelong immunity after the attack? Mumps. The most effective method of purification of water at community is filtering. Integrated Management of Childhood Illness IMCI in India adopted as IMNCI. Inhalation of cotton dust causes bichinosis. MTP Act permits abortion only up to 20 weeks. Which is the permanent method of family planning? Tubectomy and vasectomy. One of the following diseases has been eradicated globally as declared by WHO. Smallpox. Example of a live vaccine is BCG and BCG is live vaccine. Sex ratio 933 per thousand means 933 females per 1000 males, reducing the net reproduction rate (NRR) to 1 by the year 2000 AD. The couple protection rate at least to be raised was 60 by 100. Which of these used in multi-drug resistant tuberculosis? Linezolid. Herd immunity. It herd, herd immunity is not useful in prevention of tetanus. The peripheral workers of ICDS scheme is Anganwadi worker. In in the neonatal period, zidovudine syrup 2 mg per kg orally 4 times a day given for a period of 6 weeks, which is the responsibility of state nursing council. Implementation of INC standards of nursing education. The commonest cause of maternal morbidity in India is anemia. Death and birth into a community reported by ANM. Emblem for under 5 clinic contains the following objectives except protect the childhood disorders. Nurse caring for a retropositive patient with molluscum contagiosum is this secondary infection is caused by pox virus. To ensure that Montax test is positive, an area of endurations should be 10 mm. Emblem for under 5 clinic contains the following objectives except protect the childhood disorders. Chickenpox can sometimes be fatal to children who are receiving steroids. BCG measles MMR vaccine should be stored in 2 to 8 degrees Celsius. The vaccine which must be stored in the freezer compartment is polio. National Population Policy (NPP) in India was formulated in 1983. Smallpox vaccine contains living virus. Oral thrush is caused by fungus Candida albicans. Caused of typhus fever, pediculosis corporis. Kartar Singh Committee is also known as Multipurpose Worker Committee. Causative organism of chickenpox is varicella zoster. Which of the following should be investigation of choice for typhoid fever is first week Vidal test. The 7th April is celebrated as the day every year, World Health Day. Regarding cholera vaccine, all are the correct except that it is given at interval of 6 months. Inhalation of cotton dust causes bichinosis. Health Survey and Planning Committee, popularly known as Mudaliar Committee. Which one is not included in prevention of HAIs? Antibiotics for all patients. Indian Nursing Council was established in year 1947. Typhoid fever is an example of acute inflammation. A characteristic manifestation of rabies is pharyngeal spasm. Neonatal death occurs within period 1 week. A patient had an indwelling urinary catheter for 48 hours. In the pre-operative period on revisit after 1 week, he was urinary tract infection. This infection is called iatrogenic UTI.